Track, a naturopath from NZ. That means New Zealand. Thanks for coming back and looking at my channel. If you're new to this channel, which you probably are because you may have seen a few of my videos, if you haven't seen them, check out the playlist because there's a lot of stuff there. Let's talk about about eight, but there could be 20 different scenarios when it comes to a sore tongue, sore mouth, sore tongue in particular. Now, probably the first one really would be mouth ulcers, which are quite common for some people. I got some work done on my teeth a few years ago, but I think before that I had some busted teeth up the back here and all kinds of problems. And that you get sharp edges, trauma, okay? Wham, mouth ulcer. Biting your tongue, biting the buccal wall, the cheek on the inside. These things can lead to ulcers that can be white, or yellow, or greyish, or reddish sort of colour. They can be really, really painful. All right? There's all sorts of things you can do. I generally recommend people rinse their mouth with some sea salt in water. There's rhubarb extract I found works extremely well for mouth ulcers. Okay, used to be able to get this stuff called rhubarb extract, but even just crushing rhubarb juice fresh and one drop on that can really help too. Some people swear by cabbage juice, rinsing that around in the mouth. Tea tree oil, one drop of that, just with a Q-tip on the ulcer can work as well. But yeah, with ulcers, recurring ulcers, try and find out what it is. It could also be low immunity. That's another sign. Oral immunity, some medications can cause it, but often it'll be trauma. Second one, food allergies. Over the years, I've seen many people with food sensitivities or allergies. And the mouth, for example, the lips, the tongue, all that area can be really affected. Tingling, burning, numbness, funny sensations, furry sensations on the tongue. I get that if I eat kiwi fruit, a couple of kiwi fruits, because I like kiwi fruit, but if I eat the skin, I get all issues here, around here on the lips. It feels like a little bit like I run a cigarette lighter over them. It's a bit of a burn, not a nice feeling. So yeah, food allergies in terms of oral, you may also want to look for sneezing or eye sensitivities or sort of facial stuff in general. If you think carefully, it'll be a food, or it could be sometimes an inhaled allergy as well, but often it'll be a fruit of some sort will cause this one. Yeah. Third one, vitamin deficiency. Cracks in the corners of the mouth, for example, angular stomatitis, B vitamin deficiency. People who drink a lot will get this crack there. But the tongue, in terms of deficiency, I would think about B12, right? Vitamin B12 is very important for the nervous system, but keeps the tongue also in good shape. So flabby tongue, painful tongue, can be very much a sign of a B12 deficiency. Sometimes the doctor will give shots for that, give 1,000 microgram shot of B12. Iron can also create issues with the tongue, glossitis or inflammation. It can often be an iron problem. Sometimes a good multivitamin can really help in a lot of cases of tongue issues. The next one, burning mouth syndrome. I've seen that particularly with people on chemotherapy medications or some drugs can create that sensation where the mouth is burning all the time, and it can also be linked up with a kind of neuralgia, like a nerve damage. It can happen post-operative, for example, for some people who've had neck surgery or all sorts of things. Scenarios can happen. Neuralgia is the next one. So that's actually nerve pain. And again, I would be thinking maybe about pernicious anemia, again, which is low B12 because of lack of this hormone called the intrinsic factor. Neuralgia is often linked with B12 deficiency. You can have funny sensations like your hand feels it's in a glove kind of thing, or your feet feel a bit numb, looking at a neuropathy that can go with it. So neuralgia can be another sign of again, B12 or a trauma, B12 problem. Drugs would be the next one. I've seen so many pharmaceutical drugs over the years that cause issues with someone orally. Gout medications, diabetes medications, blood pressure medications. So if you're on taking a medication, excuse me, and you're getting recurring burning mouth, burning tongue, you need to see the doctor. And if your doctor doesn't want to listen, Dr. Google might want to listen. All right, and you might want to go to Dr. Google and have a bit of a search. Oral cancer. Smokers, cigarette smokers will be more prone to oral cancer. And mouth ulcers can occur, painful tongue, inflamed tongue, all sorts of issues. The dentist, the hygienist will pick this up pretty quick. Sjogren's syndrome, the last one, autoimmune disease, which causes inflammation of the lacrimal glands, salivary glands, and that causes dryness, so they can get a very dry mouth. So, but that's a bit about mouth and sort of tongue issues. So it's very important, of course, to always brush your teeth very well. I recommend an electric toothbrush. And then the hygienist, I started to go to a hygienist, I think, 2 years ago, but in New Zealand, they don't really have those sort of people here. I think it's quite big in the States, but I think dental hygiene is a critical part of maintaining really good oral health. To stop getting, periodontitis and gingivitis. And so this is the doorway to this. If this is all like a sewer and all messed up, busted teeth, rotten stuff, and it looks like a ghetto on steroids, well, you're not really going to do much for the gut down here, are you? If you've got tons of bad bacteria in here just manifesting in your gums, I mean, you're much more prone as you get older to push yourself towards autoimmune disease or heart disease. Don't believe me, go online and have a look yourself. It's important to keep the gums and teeth in good shape, right up until, well, as long as you want to live, I suppose. And like, someone said to me once, only brush the teeth that you want to keep. Don't brush the rest, they'll soon go away. Thanks for tuning in.